Diffuse iris melanoma, the most common primary intraocular tumor affecting cats, often originates as benign nevi, also known as freckles, on the iris surface. These nevi present as well-defined, flat or slightly elevated areas of increased pigmentation within the superficial layer of the iris, known as the stroma. However, over time, these initially harmless pigmentations can transition into a malignant form, infiltrating deeper into the iris stroma and causing raised areas with disruption of the normal iris architecture. This progression can extend to involve adjacent structures like the iridocorneal angle, ciliary body, and sclera, leading to complications such as uveitis, inflammation within the eye, secondary glaucoma, increased pressure within the eye, ocular discomfort, and even vision loss. While metastasis, the spread of melanoma to other parts of the body, has been reported, its occurrence is variable, ranging from 19% to 63% in different studies. The featured article, Diode laser ablation of progressive pigmented iris lesions in 317 cats, 356 eyes, by Allison A. Fuchs and colleagues, delves into a novel approach for managing this condition. This study, published in the Journal of the American Veterinary Medical Association, introduces a new scoring system, the Preoperative Pigmentation Severity Score, PPSS, designed to assess the severity of pigmented iris lesions in cats before treatment. The researchers then retrospectively examined the short-term and long-term outcomes of using transcorneal diode laser ablation to treat these lesions. Study design. This retrospective study encompassed 317 client-owned cats, 356 eyes, who underwent diode laser ablation for progressive pigmented iris lesions between January 2000 and December 2018. A novel clinical grading system, the Preoperative Pigmentation Severity Score, PPSS, was developed by the researchers to characterize the severity of feline iris hyperpigmentation. As detailed in Table 1, this system classifies iris lesions into 6 categories: iris nevus, Grade 1, Grade 2, Grade 3, Grade 4, and Grade 5, based on factors such as the extent of iris involvement, changes in the normal iris surface structure, the presence or absence of inflammation and pigment cells in the anterior chamber of the eye, and the presence or absence of glaucoma. Figure 1 visually depicts representative images for each PPSS grade, from iris nevus to Grade 5, illustrating the progression of iris lesions. Surgical technique. Before the laser ablation procedure, the cats receive topical latanoprost eye drops to constrict their pupils, making the lesions easier to visualize. They were also given pre-anesthetic medications, including pain relievers and anti-inflammatories, to ensure their comfort and well-being throughout the surgery. General anesthesia was induced and maintained using a combination of medications, and the cats were placed on a mechanical ventilator during the surgery. The area around the eye was carefully prepared using aseptic techniques to minimize the risk of infection, and topical anesthetic drops, along with phenylephrine to dilate the pupil, were applied to the eye. Diode laser transcorneal photocoagulation was performed using an 810 nm diode laser. In most cases, the laser energy was delivered through a G-probe or endoprobe without making direct contact with the cornea. Sometimes, a corneal contact lens was used to allow the probe to gently touch the cornea, ensuring that the laser was precisely focused on the lesion. Throughout the procedure, the cornea was kept moist and lubricated with sterile balanced salt solution. The primary goal of the laser treatment was to shrink the pigmented lesions. The initial phase of the treatment involved using a laser power ranging from 300 to 500 megawatts with a 50 millisecond interval between pulses. This technique, often referred to as painting the lesions, aimed to cover the affected area with laser energy. Immediately after, a second treatment was administered at a higher power of 700 to 800 megawatts, while maintaining the same pulse interval. The surgeon continuously monitored the procedure under a high-powered operating microscope to observe the desired effects of the treatment. These effects included shrinkage of the lesion, a change in color to a grayish hue, and the release of pigment cells from the treated area. Figure 2 provides a visual comparison of a Grade 3 iris lesion before and after diode laser treatment, showcasing the contraction of the lesion and the resulting uneven pupil size, known as dyschorrhea. Following the surgery, cats received appropriate pain medications and topical ophthalmic preparations, which included a combination of antibiotics and anti-inflammatories, tailored to the clinician's preferences. Cats already on anti-glaucoma medications continued their prescribed regimen. Intraocular pressure was meticulously assessed within 1 to 2 days after surgery or at the first post-operative checkup, typically scheduled between 2 weeks and 3 months following the procedure. Results. The findings of the study indicated that diode laser ablation is a generally safe procedure that can effectively slow down or halt the progression of pigmented iris lesions in cats. Moreover, the complication rates associated with this technique were found to be minimal. Out of the 356 eyes treated in the study, the following complications were observed: corneal ulceration, 25 eyes, 7%, glaucoma, 18 eyes, 5%, uveitis, 4 eyes, 1.1%, corneal edema, 3 eyes, 0.8%, 12 eyes ultimately required enucleation, the surgical removal of the eye, due to irreversible blindness and uncontrolled secondary glaucoma. In 18.5% of the cases, a repeat laser surgery was deemed necessary because of the continued progression of pigmentation in the iris. Only 2 cats in the study were euthanized due to suspected metastasis of the melanoma. A significant finding of the study was that out of the 250 cats for whom 1-year follow-up data was available, a remarkable 96% were still alive. This highlights the potential of this procedure in extending the lifespan of cats diagnosed with this condition. Secondary glaucoma, a serious complication that can lead to vision loss and discomfort, was diagnosed in 5% of the treated eyes. This complication was more frequently seen in eyes that had higher initial PPSS grades, suggesting that the severity of the initial lesion can influence the risk of developing glaucoma after laser treatment. Importantly, none of the eyes classified as iris nevus or grade 1 developed postoperative glaucoma, while 17.8% of eyes with grade 4 or higher lesions develop this complication. Discussion. The results of this study provide compelling evidence to suggest that diode laser ablation represents a feasible and potentially beneficial treatment option for managing progressive pigmented iris lesions in cats. This procedure offers a minimally invasive alternative to enucleation, which is the traditional approach to treating these lesions. The relatively low complication rates associated with diode laser ablation further support its use in carefully selected cases. However, the authors acknowledge that their retrospective study design has limitations, primarily the substantial number of patients lost to follow-up over the extended study period. This attrition could have skewed the long-term outcome assessments. Although the study strongly suggests that diode laser ablation effectively reduces lesion size and preserves ocular comfort and visual function in affected cats, the authors emphasize the need for well-designed prospective studies with comprehensive patient staging, assessment of the extent of the disease, and long-term follow-up to validate these findings and definitively determine the impact of laser treatment on the risk of metastasis. Another crucial takeaway from this study is the importance of careful patient selection, comprehensive client education about the potential benefits and risks of the procedure, and diligent post-operative monitoring. This is particularly crucial for patients with higher PPSS grades, as their risk of developing secondary glaucoma and potentially losing the affected eye is higher compared to those with less severe lesions. In conclusion, this study highlights diode laser ablation as a promising tool in the management of progressive pigmented iris lesions in cats. While further research is warranted to solidify these findings and better understand the long-term implications of this treatment modality, the current evidence suggests that it offers a relatively safe and effective means of slowing disease progression, preserving vision, and potentially improving the quality of life for affected cats. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.